Hello, I'm Dr. Brandt Gibson, and I'm here today to talk to you about the diabetic foot and how you can prevent problems with the diabetic foot. So a lot of times you'll have diabetes, and with diabetes you can actually get significant complications, significant side effects that lead to a condition called the diabetic foot. And these can really be broken down into four categories. You're going to get interference or problems with the blood flow, circulation. You're going to have problems with wounds or sores to the feet. Oftentimes they're pressure sores or injuries because you have no sensation, which is number three. The malfunction of the nervous system, whether you have peripheral neuropathy because the nerves are malfunctioning. And number four is failure to fight off infections or heal wounds. So all four of those can be really problematic by themselves, but you put all four of them together and you have a significant problem. So the diabetic foot is a big problem. A lot of times it will lead to amputations. A lot of times it leads to severe infections. A lot of times it will lead to even problems that can lead to an early death. So it's very, very important that you limit or manage those side effects. So how do you prevent damage or side effects from diabetes when it comes to the foot? Number one, you need to be aggressive at managing your diabetes. The more normal the blood sugar, the less side effects, less complications that you have. So what should be your goal? Normal blood sugars as much as possible. A lot of times you're going to be told that you want to be under 7 to have to be able to protect your feet. Well, the studies are showing you want to be lower than that. You want to be more in the range of 5 in your hemoglobin A1C to really prevent the complications that come with diabetes. Number two, you need to be very aggressive at checking your feet. The American Diabetes Association recommends that you check your feet at least once a day. My recommendation is more aggressive. You should be checking your feet twice a day. You're putting your shoes on, you're taking them off. So if you check them twice a day, when you put your before you put your shoes on or right after you take your shoes off, then those twice a day will prevent even more problems, and you can notice even a minor or small change. Number three, you should be seen on a regular basis by an individual that specializes in diabetes and especially is willing to look at your feet and ensure there are no injuries or no sores. This regular exam should happen at least once a year if you just have diabetes. Should be happening every 6 months if you have well-controlled diabetes, but you're starting to get some of the complications. And should be every 3 months or more often if you have peripheral neuropathy. So the idea is you want to be regularly evaluated and protect your feet as much as possible. Number five, you want to minimize things that could cause injury. That includes correct shoes, checking your shoes to make sure they're not worn out, but also making sure that there's nothing in your shoes before you put your foot in there. Checking water temperature so you're not burning your feet, including, of course, bath water, but also checking the surfaces that you're going to be walking on. If you're saying, okay, I'm going to walk outside, you want to make sure the cement's not hot before you're actually walking barefoot outside. And even better than that is to not go barefoot, to minimize barefoot as much as possible. So with all of these recommendations, you can truly prevent injury. You can prevent the problems that can come from diabetes, and you can prevent the real big complications for the diabetic foot. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 176.